You've probably heard about coronavirus testing, but what exactly are coronavirus tests and what information do they give us? Generally speaking, there are two types of coronavirus tests. One is a swab test where they take that cotton swab and stick it way far up your nose or down your throat, and the other one is a blood serum test where they'll prick your finger just like a diabetes test and take out the blood. Let's start with the swab test, which is also known as an RT-PCR test or a molecular diagnostic test. The purpose of the swab test is to collect mucus from the respiratory tract to see if you're currently a carrier of the SARS-CoV-2 virus, which is the virus that causes COVID-19. Importantly, these tests are qualitative, which means they'll only tell you whether or not you have the virus now, in the present. They won't tell you if you had the virus a month ago, and if you happen to get infected with the virus on the way home from the clinic, it won't tell you if you're infected with that either. It'll only tell you currently if you're a carrier of the virus. The serum test, on the other hand, also known as the serology test, can detect the presence of antibodies in the blood. Antibodies are the weapons that our body uses to fight off foreign invaders. And when a new foreign invader enters our body, the body will create a new specific antibody against that invader in order to fight it. So for example, the SARS-CoV-2 virus will have a specific antibody to that, and those antibodies will be different than the antibodies against the measles virus. Therefore, anybody who has antibodies that target the SARS-CoV-2 virus floating around in their blood must have previously been exposed to the SARS-CoV-2 virus. This is the principle that the serum tests work on. You could take the blood of a patient and test to see if they have the right antibodies against SARS-CoV-2 in their blood. If they do, then they've previously been exposed to the SARS-CoV-2 virus. If they don't, then they have not been exposed. This is important because antibodies are what confer immunity to a virus. So if someone has anti-SARS-CoV-2 antibodies in their blood, they might be immune to SARS-CoV-2 virus, which means they're immune to COVID-19. Currently, there are rapid qualitative tests which will tell you on the spot whether or not you have the presence of these antibodies in your blood, which means you've been previously exposed to the virus. Or there's more complex quantitative tests which do require the use of lab equipment, but they'll tell you exactly how many of these antibodies you have floating around in your body. So if we can use the swab test to see if someone is currently carrying the virus and use the blood serum test to see if someone is immune to the virus, why can't we just test everybody and let those who pass the test go about their day freely? Well, it turns out that a lot of these tests actually have some problems. The first issue is the issue of accuracy, and in order to understand why this is an issue, we need to understand the concepts of false positive and false negative results. In the perfect world, you would expect that anybody who tested positive for the virus actually had the virus, and anyone who tested negative for it did not have it. But the world is not perfect, and these tests do have some degree of error. And these errors are called false positives and false negatives. A false positive error will occur when someone tests positive for the virus, but does not actually have the virus. And a false negative error is the exact opposite. Someone who tests negative for the virus actually does have it. These results are really dangerous because we don't know when they occur. They don't look any different than true positive and true negative results, so usually they slip under the radar. Imagine if someone took the coronavirus swab test and the test came back as a false negative. Remember, the swab test was a test that tells you if you currently are a carrier of the virus. And so a false negative result would mean that the person tested negative for the virus, but actually they do have the virus. This individual, who's now confident that they're completely healthy, starts going around to stores and supermarkets or crowded areas. They could have infected everybody in those areas because in their mind, they're completely healthy, but of course they have the virus. Now, imagine that someone who took the blood serum test got a false positive result, which means that they tested positive for having anti-SARS-CoV-2 antibodies in their blood, even though they don't actually have those antibodies. Well, now you have somebody who thinks they're immune to the virus because they tested positive for antibodies against it, going out into public without realizing how much of a risk they're putting themselves into. There are currently some 100 serum tests available on the market, and each of these tests differs from one another. Either in the chemicals they use or the parts of the antibody that they target, they all work in different ways. Because there are other coronaviruses similar to this one that could infect humans, 4 of which have been known to cause the common cold, the antibody test needs to be really specific so that it can distinguish this coronavirus from the other ones, which is the challenge. Don't get me wrong, having a lot of tests is a good thing, but many of these tests are not vetted or approved by the FDA, which means we need to be very careful in choosing the right test if we're to avoid costly mistakes. First, as we previously discussed, there's a huge amount of error in some of these tests. Some swab tests, for example, have false negative rates of up to 40%, which means that 40% of people who tested negative for the SARS-CoV-2 virus actually had the virus. Serum tests might also be less valuable than people think because antibodies take quite some time to develop, up to a few weeks. So just because someone tests negative today doesn't mean they haven't been exposed to the virus in the past, their antibodies just might not have developed yet. There's also the fact that different cohorts of people will develop different amounts of antibodies, which could provide misleading results as well. It's also important to note that just because someone does test positive on the serum test, meaning that they do have antibodies against the SARS-CoV-2 virus, does not mean that they will have long-term immunity. Although there are studies suggesting that antibodies do confer long-term immunity, some researchers are skeptical because it's possible that reinfection with SARS-CoV-2 virus is a big concern. There's also evidence that the SARS-CoV-2 virus has mutated into up to 30 different strains. Now, that does not mean that there's up to 30 new coronaviruses. However, the antibodies developed against one strain of coronavirus might not be as effective against other strains of coronavirus. Needless to say, we are far from an immunity passport that would allow someone who has cleared the coronavirus tests to go about their daily life without having any other fear of the coronavirus. Many cities are beginning to relax their social isolation policies, and with these inconclusive test results in mind, we must all do what we can to help reduce the spread of the virus. Minimize your contact with others unless absolutely necessary, wear a mask, and wash your hands. Thank you so much for watching today's video. If you enjoyed it, I'd really appreciate it if you left me a like down below because it really does help my channel, and subscribe for new content every single week. My name is Eviatar, and as always, stay healthy, stay positive, and have a wonderful day.